So if you've had a previous hair transplant and you might be thinking it's time for another one, then let's talk about it. There's a couple of different reasons why you might need or want to have your next hair transplant surgery. So if it's been a few years from your previous transplant, guess what? Hair loss sometimes can continue, and even though the transplanted hair is permanent, your other hair is not. And so you could notice some thinning, perhaps even behind the transplant in another area that was not transplanted that now needs a fill-up, a touch-up, or some refinement. You could also have some areas perhaps in the frontal hairline, like you may want to lower the hairline or densify it or change it a little bit since your original procedure. And all of these things can be easily accomplished today with minimally invasive techniques. As you go farther back into the crown area, you might notice that you're seeing a little bit more thinning outside of your previous transplant zone, and of course we can fill that area in. Now if you had an old style transplant with a linear harvest, you may have had an old linear scar left behind from that transplant procedure. And today there's a number of things that we can do to fix that scar tissue. We can fill it in with hair, we can adjust the pigment of the skin by using microneedling and PRP. We can actually apply scalp micropigmentation. So there's a number of different things that we can chat about if you're concerned about some old scar tissue that's limiting your hairstyle. And of course, if you had your procedures done really in the old days and you're left with some kind of a pluggy or unusual looking result, well, the good news is that we can take out some of those follicles, maybe all of them, and redistribute them back into the thinning or the balding areas and totally, completely refine a pluggy transplant look from years ago. Now, if you've had a number of previous transplants, you might be worried, where are we going to get the hair? Because everyone's born with just a limited amount of donor hair in the back of the scalp. And even though today we can kind of tiptoe through those areas using follicular unit extraction, that minimally invasive style, there are alternative sources of donor that we can use. And one of the most popular non-scalp transplants that we're harvesting from, or non-scalp areas that we're harvesting from, is the beard. And just about every single week, maybe several times a week, we're putting beard follicles up on the scalp. So if you've had previous transplants and you think you might be donor depleted and you may not be a candidate, don't forget about your beard, because that's a great source of donor hair. And if you're interested in beard transplants or other types of refinement, corrective procedures, or just a little touch-up or refinement of what you previously had, click on the link below and let's chat about it during your consultation.